सो हाय गाइस, आज हम लोग पढ़ने जा रहे हैं टीवी। सो बेसिकली हम लोग टीवी में ना हमारा प्रोग्राम्स है, ठीक है। उस प्रोग्राम को पढ़ेंगे। ये अभी हम लोग पूरा टीवी नहीं पढ़ रहे, रादर वी आर रीडिंग नेशनल टीबी एलिमिनेशन प्रोग्राम, NTEP इसको बोलते हैं। सो वी विल बी रीडिंग NTEP। हाय मम्मी। तो मम्मी अभी हम लोग ना टीवी पढ़ने जा रहे हैं। नेशनल टीबी एलिमिनेशन प्रोग्राम विल बी रीडिंग। हेलो। So just give me 1 minute. Yeah. So let's read. Okay. So national tuberculosis program जो होता है, that has been in operation since 1962. This is very important. पता है क्यों? क्योंकि this comes in 10 markers. So this is a very 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 important part. So I'm sharpening my pencil. Okay. So let's move ahead. So National Tuberculosis Program जो है has been in operation since 1962. 1962 यानी कि आज़ादी के 20 साल, ऑलमोस्ट 20 भी नहीं, कितना 15 साल के बाद से नेशनल ट्यूबरकुलोसिस प्रोग्राम शुरू हो गया था। हाउएवर द ट्रीटमेंट सक्सेस were unacceptably low and the death and default rate remaining very high. So spread of multi-drug resistant TB was threatening to further worsen the situation. तो फिर क्या हुआ कि 1993 में in order to overcome these lacunae, the government of India decided to give a new thrust to TB control activities by revitalizing the NTP with assistance from international agencies. So the revised National TB Control Program, RNTCP, देखो नेशनल ट्यूबरकुलोसिस प्रोग्राम से रिवाइज्ड नेशनल ट्यूबरकुलोसिस कंट्रोल प्रोग्राम हो गया। कंट्रोल वॉज द न्यू वर्ड एडेड एंड रिवाइज वॉज द न्यू वर्ड एडेड, तो RNTCP बन गया। Thus formulated adopted the internationally recommended DOTS। ये पता है MCQ में डॉट्स का फुल फॉर्म भी पूछ लेता है। टीबी इज़ वेरी इंपॉर्टेंट। तो डायरेक्टली ऑब्जर्व्ड ट्रीटमेंट शॉर्ट कोर्स है, शॉर्ट कोर्स, ठीक है। डायरेक्टली ऑब्जर्व्ड ट्रीटमेंट शॉर्ट कोर्स स्ट्रैटेजी। तो इंटरनेशनली डॉट्स चलता था, अब हम लोगों ने भी डॉट्स अपना लिया। कब? 1993 में। एज द मोस्ट सिस्टमैटिकली एंड कॉस्ट इफेक्टिव अप्रोच vitalize the TB control program in India. Now, political and administrative commitment to ensure the uh, hello Benj Belam OC Sandang. So Belam, we are reading National Tuberculosis Elimination Program. So TB जो था ना, that was very prevalent earlier, पर फिर 1993 गवर्नमेंट ऑफ इंडिया जो है, it launched another program that was known as Revised National Tuberculosis Control Program, thus formulated, adopted the internationally recommended DOTS. DOTS उसमें हम लोग use करते थे. So what is DOTS? So directly observed treatment short course strategy as the most systematically and cost-effective approach to revitalize the TB control program in India. So political and administrative commitment to ensure the provision of organized and comprehensive TB control services was obtained. So adoption of smear microscopy for reliable and early diagnosis was introduced in a decentralized manner. क्या बोल रहा है कि adoption of smear microscopy for reliable and early diagnosis. So microscopy introduce कर दिया गया था. Now early diagnosis or introduced in a decentralized manner in the general health service. So DOTS was adopted as a strategy for provision of treatment to increase the treatment completion rate. Supply of the drug was also strengthened to provide assured supply of drug to meet the requirement सिस्टम। सो ऑब्जेक्टिव क्या था RNTCP का? दो ऑब्जेक्टिव था क्या? अचीव एटलीस्ट 85% क्योर रेट of infectious disease of tuberculosis through dots involving peripheral health functioning. 85% क्योर रेट हमारा strategy था. And what was the other strategy? So the other strategy was augmentation of case finding activities through quality spectrum microscopy to detect at least 70% of estimated case. माइक्रोस्कोपी से हम लोगों को डिटेक्ट करना था. दीज वर द टू objectives of RNTCP. So the revised strategy was introduced in the country in a phased manner. The RNTCP was expanded rapidly over the year, and since March 2006 it covers the whole country. RNTCP has now entered into its second phase, in which the program aims to consolidate the सो ये सेकेंड फेज़ में 2000 मार्च 2006 में क्या हुआ कि RNTCP जो है ना वो सेकेंड फेज़ में आ गया, जिसमें क्या होगा? प्रोग्राम एम्स टू कंसोलिडेट द गेन मेड टू डेट एंड वाइडन सर्विसेज इन टर्म्स ऑफ एक्टिविटी एंड एक्सेस and to sustain the achievements. So, the new initiative and the wider collaboration with other sectors aim to provide standardized treatment and diagnostic facilities to all TB patients, irrespective of the healthcare facilities from which they seek treatment. RNTCP also envisages improved access to marginalized, such as urban slum dwellers and tribal groups. So RNTCP जो था is built upon infrastructure already established by the previous National Tuberculosis Program, while incorporating the elements of the internationally recommended DOTS. मतलब वो पिछले वाले पे ही based on था, बस internationally DOTS को भी ला दिया था RNTCP. A DOTS strategy adopted by revised National TB Control Program initially had the following five main components. क्या political DOTS में क्या five main components था? तो political will and administrative commitment, ये politics से related है. And what else was there? Diagnosis by quality assured spectrum spectroscopy. Why is there ants in my table? Please. Oh, so let's move ahead. We have wasted some time. So, diagnosis by quality assured spectrum smear microscopy. So, microscopy यूज़ वॉज द सेकेंड ऑब्जेक्टिव ऑफ डॉट्स. डॉट्स का क्या क्या स्ट्रैटेजी है ये पूछेगा. पहला पॉलिटिकल विल, दूसरा है माइक्रोस्कोपी. आई मीन डॉट्स RNTCP का हम ये लोग बता रहे हैं. माइक्रोस्कोपी. तीसरा है एडिक्वेट सप्लाई ऑफ क्वालिटी एश्योर्ड शॉर्ट कोर्स कीमोथेरेपी ड्रग्स. तीसरा वॉज ड्रग्स. चौथा इज डायरेक्टली ऑब्जर्व्ड ट्रीटमेंट, ऑब्जर्वेशन. Fifth is systematic monitoring and accountability. Again, monitoring and accountability. So in 2006, STOP, Stop TB strategy, was announced by WHO and adopted by RNTCP. ठीक है. स्टॉप टीबी स्ट्रैटेजी 2006 में आया था. WHO ने अनाउंस किया था और उसको RNTCP अडॉप्ट कर लिया स्टॉप टीबी को. सो द कंपोनेंट आर एज फॉलोज: pursuing quality dots expansion and enhancement, addressing TB, HIV and MDR TB, contributing to health system strengthening, engaging all care providers, empowering patients and communities, enabling and promotion research. ठीक है. So diagnosis, treatment and vaccine. Many of the initiatives like developing and piloting the feasibility of national airborne infection control guidelines, developing the piloting strategy for practical approach to lung health are the examples of initiative taken by RNTCP under the comprehensive strategy of Stop TB. दो क्या strategy है? The National Airborne Infection Control Guidelines or Practical Approach to Lung Health. Now in 2014, the World Health Assembly unanimously approved. 2014 का बात हो रहा है, ये सब 2006 का बात था. 2014 में क्या हुआ? वर्ल्ड हेल्थ असेंबली जो है अनोनिमसली अप्रूव्ड द एंड ग्लोबल टीबी एपिडेमिक बाय एंड टीबी स्ट्रैटेजी. इसके बाद क्या आ गया? एंड टीबी स्ट्रैटेजी आ गया. अ 20-year प्रोग्राम with vision of a world with zero death disease suffering due to TB. For details, please refer to page 241. Okay. Now, in view of end TB targets, the program has been renamed from RNTCP to National Tuberculosis Elimination Program. अब तो हम लोग को एंड करना है ना, तो हम लोगों ने उसका नाम RNTCP का नाम चेंज करके 2014 में NTEP कर दिया, National Tuberculosis Elimination Program. So what are the words that has been changed? So first was is any elimination, second is we have removed revised word. ठीक है, तो NTEP हो गया. Now NTEP organogram क्या है? NTEP structure comprises of 5 level: national, state, district, sub-district और peripheral health institution as levels shown in the figure 2. Supporting facilities क्या है? National Institute, National Reference Laboratories, Intermediate Reference Laboratories. Then we have State TB Training and Demonstration Center, Culture and DST Laboratories, Nodal Drug Resistant TB Centers, CB-NAT Laboratories. These are the supporting facilities. 1, 2, 3, 4, 5, 6, 7. 7 supporting facilities are there. Then we have Ministry of Health and Family Welfare. We have Central TB Division, State TB Cell. 37 states and union territories are there. Then we have District TB Centers. 767 districts are there. Then we have TB unit, 1 per 1.5 से 2.5 lakh population. Then we have designated microscopy center for 50,000 to 1 lakh population. And we have Peripheral Health Institution and Arogya Mandir. Ayushman Arogya Mandir, PHI, Peripheral Health Institution, Microscopy Center, TB Unit, District TB Center, State TB Cell, Central TB Division, Ministry of Health and Family Welfare के अंडर सब कुछ आता है. So national level. Let's read about the national level. So Central TB Division. सो बेसिकली इसके बारे में बात हो रही है. मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर के नीचे क्या है? सेंट्रल टीबी डिवीज़न. तो नेशनल लेवल ये है. दिस इज़ द नेशनल, दिस इज़ द स्टेट लेवल, दिस इज़ द डिस्ट्रिक्ट लेवल, और उसके बाद तो फिर नीचे आ जाएगा डिस्ट्रिक्ट के अंदर. ठीक है. तो नेशनल लेवल, सो नेशनल लेवल, state level, then district level, then sub-district level, tuberculosis unit level, then peripheral health institution PHIs. ठीक है. ये देख लेते हैं हम लोग. सो नेशनल लेवल के बारे में क्या बोलता है? सेंट्रल टीबी डिवीजन CTD जो है मैनेजेस द नेशनल टीबी कंट्रोल प्रोग्राम फॉर द एंटायर कंट्री एट द सेंट्रल लेवल अंडर AS एंड DG यानी RN, TCP एंड NACO through a national program manager, deputy director, general TB, DDG TB. Now, the financial and administrative control of the program is managed by joint secretary from the administrative arms of the Ministry of Health and Family Welfare. So, the CTD, यानी Central TB Division जो है, is supported by National TB Institute, Bengaluru, 6 National Reference Laboratory, and including NTI, National Institute for Research in Tuberculosis. Then we have Chennai, National Institute of Tuberculosis and Respiratory Disease, Delhi, National Japanese Leprosy Mission for Asia, Jalma. Then we have Institute for Leprosy and Other Microbacterial Diseases, Agra Regional Medical Research Center, Bhubaneswar, and Bhopal Memorial Hospital and Research Center, Bhopal. The CTD. Hi Shashank. So we are reading about tuberculosis. ठीक है. तो टीबी के बारे में हम लोग पढ़ रहे हैं. तो टीबी का जो NTEP जो स्ट्रैटेजी था ना शांक, उसका ऑर्गेनोग्राम देख रहे. तो ऑर्गेनोग्राम क्या होता है? सो पहला किस तरीके से जो पावर है, मतलब जो प्रोग्राम है वो कैसे छोटे छोटे पार्ट्स में बटा हुआ है. तो मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर जो है वो सेंट्रल टीबी डिवीज़न जो कि पूरे सेंटर यानी पूरे इंडिया को कंट्रोल करेगा, इंडिया में टीबी का प्रोग्राम देखेगा, उसको फंडिंग करती है. सो नेशनल इंस्टीट्यूट और नेशनल रेफरेंस लेबोरेटरी जो है ये दोनों इसे चलाते हैं. ठीक है. उसके बारे में हम लोग पढ़ रहे हैं नेशनल लेवल के बाद. इसके बाद आएगा स्टेट टीबी सेल्स जो कि 37 स्टेट और यूनियन टेरिटरीज को ये करता है. नाउ हम लोग देख रहे हैं कि कहाँ कहाँ पे है ये सब. भुवनेश्वर में है. देन ये वो. देन द CTD क्या हो गया? सेंट्रल टीबी डिवीजन जो है इज़ ऑल्सो सपोर्टेड बाय नेशनल टास्क फोर्स फॉर कोलैबोरेशन ऑफ मेडिकल कॉलेजेस एक्टिविटीज़ इन द कंट्री थ्रू ZTF एंड STF. I'm so sorry, Belliam. I cannot understand your language. Then various committees of experts to guide the program at different levels on technical and policy matters are there supporting Central TB Division. So let's see about the state level. State level में क्या होता है? So the state have total ownership and accountability of the TB control in their state. हर state का उस state में किस तरीके से होगा वो state level पूरी तरीके से उनके पास ownership है और accountability है. State Health Society or its equivalent under National Health Mission of the state manages the TB control program. A full-time state tuberculosis officer जो होता है trained at national level and based on the state TB cell is responsible for planning, training, supervising and monitoring the program in all the districts of their respective state. STO is administratively accountable for the state government, technically follows the instruction of the SCTD and coordinates with the CTD and the district and is assigned by other technical and secretarial staffs. So, a state TB cell in being supported by state TB training and demonstrative centers. I'm so sorry, Belliam. I cannot understand your language. If you write in English, I'll be able to understand. Otherwise, I won't be understand what I have you written. So state TB cell जो होता है is being supported by the state TB training and demonstrative center in many states through its three-unit training unit, supervision and monitoring unit, and an intermediate reference laboratory (IRL), supporting an effective quality assurance system of the sputum smear, a microscopic network, and laboratory services for the PMDT, molecular DR testing, and C and DST in the state. So, operational research is also a component of STDC. Each state also has one fully operational state drug store for each 5 crore population. स्टेट ड्रग स्टोर होता है हर स्टेट के पास 5 करोड़ पॉपुलेशन के लिए. इट इज़ रिस्पॉन्सिबल फॉर इफेक्टिव मैनेजमेंट ऑफ मेडिसिन and other logistic and ensuring uninterrupted supply of good quality first and second line anti-TB medicine for adult and pediatric population. Now district level क्या होता है? So the key level for the management of primary health care services is the district. The chief district health officer या चीफ डिस्ट्रिक्ट मेडिकल ऑफिसर CDMO या सिविल सर्जन or equivalent functionary in the district is responsible for all medical and public health activities including control of TB. So the district tuberculosis center DTC जो होता है is the nodal point for TB control activities in the district tuberculosis center जो होता है जो district TB center है. This is the nodal point for TB control activities in a district. A full-time district tuberculosis officer trained at national level and based at the DTC is responsible for planning, training, supervising and monitoring the program in the district. The DTO is assisted by other technical and secretarial staff. The primary role of DTC is a managerial role. No, I'm not getting what you're saying. HR or something. City doing. No, I'm so sorry. I can't understand the language that you're speaking, Belliam. Now सब डिस्ट्रिक्ट लेवल हम लोग देख लेते हैं. सब डिस्ट्रिक्ट लेवल इज़ हम लोगों ने क्या क्या देख लिया. हम लोगों ने ये देख लिया मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर, सेंट्रल टीबी डिवीज़न जो कि सेंटर में होता है, स्टेट टीबी डिवीज़न जो स्टेट में होता है, देन डिस्ट्रिक्ट टीबी डिवीज़न देख लिया जो 767 डिस्ट्रिक्ट्स में है. ना अब हम लोग देखने जा रहे हैं सब डिस्ट्रिक्ट लेवल जो कि टीबी यूनिट्स होंगे 1/1.5 से 2.5 लाख पॉपुलेशन में होता है. So what's that? So integrating the TB control program with the health system increases effectiveness and efficiency of TB care and control. India's TB control program has been mainstreamed efficiently with National Health Mission. ठीक है, इंडिया का जो टीबी प्रोग्राम है ना उसको नेशनल हेल्थ मिशन के साथ मेन स्ट्रीम किया गया. सो अ मेजर ऑर्गेनाइजेशनल चेंज इन NTEP इज़ द सीजेशन ऑफ सब डिस्ट्रिक्ट लेवल, यानी ट्यूबरकुलोसिस यूनिट इसका बंद कर देना, सब डिस्ट्रिक्ट लेवल का सीजेशन कर देना. इट्स अ मेजर ऑर्गेनाइजेशनल चेंज. द TU इज़ द नोडल पॉइंट फॉर TB कंट्रोल एक्टिविटीज़ इन द सब डिस्ट्रिक्ट. TUs आर बंद नहीं किया शायद, यहाँ पे तो क्रिएशन लिखा है, सॉरी सीजेशन नहीं लिखा है. सो क्रिएट किया गया कि सब डिस्ट्रिक्ट लेवल में एक एक ट्यूबरकुलोसिस यूनिट क्रिएट करेंगे. तो ये नोडल पॉइंट होता है, ठीक है, सारे ट्यूबरकुलोसिस कंट्रोल प्रोग्राम का in the sub-district. The TU are based mainly on NHM health blocks with the overall aim to align with the NHM block programs management unit for optimum resource utilization and appropriate monitoring. So the urban areas, the TUs have been created based on the population of 1 per 2 lakh ranges 1.5 से 2.5 lakh for rural and urban population and 1 per 1 lakh यानी 0.075 से 1.25 lakh population in the hilly tribal difficult areas. So the tuberculosis unit consists of a designated medical officer, tuberculosis control, as well as one full-time supervisory staff, senior treatment supervisors. However, one senior TB laboratory supervisor will continue to be in 5 lakh population, 1 per 2.5 lakh population for the tribal, hilly and difficult areas. So there is a provision of additional STS if more than 300 TB cases are registered in public sector annually in the TU. Additional STS if more than 50 private health establishments are registered in NICSHAI in the TU, and more than 200 TB patients are notified from these private health establishment annually in the TU. So NICSHAI is the app. Okay, Belliam. So, the block medical officer also functions as a medical officer TB control for the urban TB units. A medical officer from the health facility where TU is located should be designated in coordination with CMHO to function as a MOTC. All MOTC should be trained in NTEP at the state level institution. MOTC has the overall responsibility of management of TB control program at the TU and is expected to undertake supervisory visits for 7 days in a month. The term STS and STLS are under the administrative supervision of the MOTC and the DTO. The TU will have one microscopic center for every 1 lakh population, 50,000 in tribal, desert, remote, and hilly regions, referred to as designated microscopic uh, center. However, for complete geographical coverage, microscopic services at the PHC level. Microscopic center may also be established beyond the population norm in medical college, corporate hospitals, ESIC, railway, NGOs, private hospitals. माइक्रोस्कोपी सेंटर के बारे में बोल रहा है कि ये सब तो इधर भी इस्टेब्लिश हो जाएगा ना. पेरिफेरल हेल्थ इंस्टीट्यूट, दिस वेरी इंपॉर्टेंट फॉर द पर्पस ऑफ NTEP. द पेरिफेरल हेल्थ इंस्टीट्यूट इज अ हेल्थ फैसिलिटी विच इज़ मैनेज्ड बाय एट लीस्ट अ मेडिकल ऑफिसर at this level. There are dispensaries, PHCs, CHCs, referral hospital, major hospital, and specialty clinics or hospitals including other health facilities, TB hospital, ART centers, medical colleges within the respective district. All health facilities in the private and NGOs participating in NTEP are also considered as PHIs. yani Peripheral Health Institute by the program. Some of these PHIs also functions as DMCs. DMCs ये हो गया district वाला. Now, Peripheral Health Institute undertake tuberculosis case finding and treatment activities as part of the general health case and treatment general health services in situation where more than one MO is posted in any of the peripheral health center. One of them may be identified and entrusted with the responsibility of NTEP. There is one TB health visitor per 1 lakh urban population to support the urban TB control activities. अब हम लोग देख लेते हैं टीबी लैबोरेटरी सर्विसेज. ठीक है, टीबी लैबोरेटरी सर्विसेज में क्या क्या आ जाएगा. सो दिस इज ए, दिस इज बी. ठीक है, देन वी हैव सी बी नैट साइट DRTB, ये बी के अंदर आता है. देन वी हैव सी. ठीक है, तो A, B and C कम्स अंडर इट, है ना. दिस वन इज A, B and C. ठीक है. So the TB laboratory services के अंदर क्या आता है. So the services of the laboratory are utilized for diagnosis TB and drug resistant TB cases and for monitoring of treatment of these patients. So the laboratory network under NTEP is a tier system for provision of diagnostic services and maintaining its quality. So, a peripheral laboratory are situated in public sector like the dispensary, PHC, CHCs, referral hospital, major hospital, specialty clinics and other sector hospital, TB hospital, medical colleges, and in the private NGO sectors for establishment of microscopic centers. So, for establishment of microscopic centers in a lab, it must have adequate physical infrastructure, binocular microscopy, and a trained LT. So, these laboratories are uh, co- covered under quality assurance mechanism. So, some of the labs not having facilities for sputum microscopy function as a sputum collection centers. Such facilities are also established in the area such as tribal, hilly, desert and difficult to reach areas of the country for improving the access to of diagnostic services. ठीक है. So, next we have in additional large hospitals and medical hospitals have facilities. जैसे मेडिकल हॉस्पिटल लार्ज हॉस्पिटल होता है ना, उनके पास फैसिलिटीज़ होता है डिजिटल एक्सरे का, रैपिड मॉलिकुलर टेस्ट यानी कार्ट्रेज बेस्ड न्यूक्लिक एसिड एम्पलीफिकेशन टेस्ट CB नैट, एंड लाइन प्रोब ऐसे LPA का, फाइन नीडल एस्पिरेशन साइटोलॉजी FNAC का, हिस्टोपैथोलॉजी एंड कल्चर एंड DST फॉर डायग्नोस्टिक सर्विसेज ऑफ द TB. ये हो गया हमारा लेबोरेटरी के बारे में. सो ये क्या था, पेरिफेरल लेबोरेटरी के बारे में था. उसके बाद क्या है हमारा, स्टेट लेवल में बात हो रही है. स्टेट लेवल में क्या है, एट द स्टेट लेवल अ नोडल लेबोरेटरी इज designated as intermediate reference laboratory, which is usually situated in the state TB training and demonstration center, medical colleges, public health laboratories. The main function of IRL are monitoring of the laboratory services across the state and maintaining of its quality through the external quality assurance. There are 27 IRLs with facility for culture and DST using phenotyping, LJ in liquid culture, MGIT, genotyping technology, LPA and CBNAT. So CBNAT side देख लेते हैं. So in addition to the culture DST laboratories, CBNAT centers are also established to diagnose rifampicin resistance among all the TB patients. Universal DST. So usually these are established in DTC, मतलब district में, and TB units and medical colleges. So the country is in the process of expanding CBNAT site network. They also serve to diagnose TB among presumptive TB cases from key population. So DRTB centers क्या होता है? DRTB centers are specialized center for clinical management of drug resistant TB. So a state regional division level, there are nodal DRTB centers to manage seriously ill drug resistant TB and drug resistant TB with expensive resistance, and DRTB cases are to be treated with regimen containing new drugs जैसे bedaquiline and delamanid. जो ड्रग रेजिस्टेंट टीबी है उन्हें बेडाक्विलिन और डेलामैनिड से ट्रीट करेंगे. सो एट द डिस्ट्रिक्ट लेवल देयर आर डिस्ट्रिक्ट ड्रग रेजिस्टेंट टीबी सेंटर्स, DDRT BC कहते हैं, टू मैनेज DRTB cases with multi drug resistant TB and H mono या poly resistance. Their centers will function under the guidance of NDR-TBC. So as we can see it here, is it visible? One second. ठीक है. Now so at the district level there are district DRTB centers to manage DR drug resistant TB cases with multi drug resistant and all that. See में क्या है? At the central level there are 6 designated national reference laboratories, namely National Tuberculosis Institute Bangalore, National Institute Research in Tuberculosis NIRT Chennai, National Institute of Tuberculosis and Respiratory Disease. NITRD, Delhi National Jalma Institute, Agra, and we have Regional Medical Research Center, Bhubaneswar, and Bhopal Memorial Hospital and Research Center, Bhopal. NIRT Chennai is also a supranational research laboratory for World Health Organization for the Southeast Asia region. So NTI is a WHO collaborating center for training, while NITRD is WHO Center for Excellence in TB Laboratory Services. ट्रेनिंग के लिए NTI है, NIRD is for TB laboratory services के लिए. Now we have the NRL. The NRLs are mainly responsible for external quality assurance of lab network, drug resistance, surveillance, training, and research. So, quality assured TB diagnosis services are offered free of cost to all the patients seeking care in the public health system, as well as those referred from the private sector through a network of laboratory under NTEP. ठीक है, आगे देखते हैं. National policy for diagnosis. This is important. सो नेशनल पॉलिसी फॉर डायग्नोसिस क्या है? सो ड्रग सेंसिटिव का एक पॉलिसी है एंड ड्रग रेसिस्टेंस का एक पॉलिसी है. सो लेट्स रीड. ड्रग सेंसिटिव टीबी जो होता है उसके लिए ऑफर ऑफ अपफ्रंट नैट फॉर डायग्नोसिस ऑफ टीबी एंड हैज़ बीन प्रायोरिटाइज्ड बाय द प्रोग्राम. So response to DSTB treatment is monitorized by using sputum smear microscopy. So drug resistant sputum से हम लोग ये कर लेंगे. ड्रग जो सेंसिटिव होता है उसको मॉनिटर करेंगे स्पूटम से बार बार. और नैट से सीवी नैट से बेसिकली हम लोग इसका डायग्नोसिस करेंगे, स्पूटम से उसका रिकवरी मॉनिटर करेंगे. ठीक है, ड्रग सेंसिटिव का. ड्रग रेजिस्टेंट का क्या करेंगे? माइक्रोबायोलॉजिकली कंफर्म टीबी पेशेंट्स आर ऑफर्ड सीवी नैट फॉर डिटरमाइनिंग द रेजिस्टेंट टू रिफैम्पिसिन. ठीक है ना. फर्स्ट लाइन प्रोब ऐसे इसे करेंगे इज ऑफर टू पेशेंट विथ रिफैम्पिसिन सेंसिटिव, अगर रिफैम्पिसिन से सेंसिटिव है, एंड रिफैम्पिसिन रेसिस्टेंट टीबी. सो सेकेंड लाइन एलपीए किसको करते हैं? इज ऑफर टू रिफैम्पिसिन रेसिस्टेंट एंड आइसोनियाजाइड रेसिस्टेंट. ये दोनों एच आर रेसिस्टेंट वाले को सेकेंड लाइन प्रोब ऐसे कहते हैं ना. लिक्विड कल्चर किसको कहते हैं? लिक्विड कल्चर एंड डीएसटी आर परफॉर्म फॉर डिटरमाइनिंग रेजिस्टेंट टू एडिशनल ड्रग्स. ना एलसी जो है यानी लिक्विड कल्चर इज यूज फॉर मॉनिटरिंग रेस्पॉन्स ऑफ ड्रग रेजिस्टेंस टीबी ट्रीटमेंट. ठीक है. The tiered system of laboratory network includes culture and drug susceptibility testing laboratories, NAT facilities, and microscopic facilities at national, state, district, sub-district, and peripheral levels as shown in the figure 3. सो आगे पढ़ते हैं. नेशनल या बेलियम National Reference Institute Laboratories. नेशनल रेफरेंस लैबोरेटरीज जो होता है, इंटरमीडिएट रेफरेंस लैबोरेटरीज एंड सी एंड DST laboratories are equipped to perform DST by various technologies such as liquid culture and molecular tests such as LPA and NAT. Now national रेफरेंस लेबोरेटरी और जो IRL है वो कंडक्ट ट्रेनिंग एंड हाउस होल्ड एंड MNE जो है फॉर द रेस्पेक्टिव स्टेट एंड डिस्ट्रिक्ट block level facilities laboratory. Among 87 laboratories which are equipped to support LC system, 68 are certified for the first line liquid culture drug susceptibility test and 60 are certified for second line liquid culture DST. Overall, 88 laboratories are certified for FL LPA and 78 laboratories are additionally certified for SL LPA. 56 laboratories are certified for performing LC DST to linezolid and pyrazinamide. And NIRT Chennai, NITRD New Delhi, NTI Bangalore, Sir JJ Hospital, Grand GMC Mumbai, PD Hinduja Hospital Mumbai, and CMC Vellore are certified for performing LCDST to bedaquiline and delamanid. सो न्यू इनिशिएटिव्स, ये 4 न्यू इनिशिएटिव्स देख लेते हैं हम लोग, उसके बाद विल रैप अप. ओके, सो फर्स्ट इनिशिएटिव इज निक्षय. निक्षय में क्या है कि टीवी सर्विलेंस यूजिंग अ केस बेस्ड एंड वेब बेस्ड आईटी सिस्टम, सेंट्रल टीवी डिवीजन इन कोलैबोरेशन विथ नेशनल informatics center has undertaken the initiative to develop a case based web based application named as Nikshay. The word is combination of two Hindi words, Ni and Kashay, meaning eradication of TB. Now, this software was launched in May 2012 and has the following functional component: master management, user detail, TB patient registration and detail of diagnosing, DOTS provider, HIV status, follow up, contract tracing, outcome. ये सब था, ठीक है. Now, detail of solid and liquid culture, DST, LPA, CBNAT detail. Hi, mummy. So, drug resistant TB patient का registration with details, referral and transfer of the patient. ये सब निक्षय ऐप में था. Private and health facility registration and TB का notification. So, mobile application for TB notification, SMS alert for patient on registration, SMS alert to program officer, automated periodic reports, case finding, sputum conversion, treatment outcome. ठीक है. The program has started using IT enabled adherence tool like 99 dots for HIV TB patient. This will be expanded to all the TB patients with implementation of daily regimen. So TB notification क्या होता है? In order to ensure proper diagnosis and management of TB cases and to reduce TB transmission and the emergence and the spread of multi-drug resistant TB, it is essential to have complete information of all the TB cases. So, according to the Government of India, notification date 7 May 2012, it is now mandatory for all healthcare provider to notify every TB case to the local authority, that is district health officer and CMO of a district and municipal health officer एवरी मंथ इन अ गिवन फॉर्मेट. टीबी का सारे केसेस को डॉक्टर्स को, सीएमओ को या फिर डीएचओ को हमें नोटिफाई करना होता है. देन बैन ऑन टीबी सीरोलॉजी. इसका क्या मतलब होता है? द सीरोलॉजिकल टेस्ट आर बेस्ड ऑन एंटीबॉडी रेस्पॉन्स विच is highly variable in TB and may reflect remote infection rather than active disease. Currently available serological tests are having poor specificity and should not be used for the diagnosis of pulmonary or extrapulmonary TB. Their import, manufacturing, sales, distribution, use is banned by Government of India. Now, direct benefit transfer scheme क्या होता है? So, it is direct beneficiary transfer system are being established by linking TB patient reported in Nikshay with Aadhaar and PEMS to effectively deliver benefit to TB patient and their providers. So, initiation of treatment. इसमें क्या है ये देख लेते हैं हम लोग. इनिशिएशन ऑफ ट्रीटमेंट देख लेते हैं एंड देन वी विल रैप अप. ठीक है. So early identification of people with high probability of having TB, presumptive TB, is the most important activity of the case finding strategy. Patients present themselves with symptoms suspicious of TB and are screened through two sputum smear examinations. Sputum microscopy examination is done in designated RNTCP microscopic centers. They are located either in the CHCs, PHCs, Tulka Hospital, or in the TB dispensaries. ठीक है गाइस, आगे हम लोग बाद में पढ़ते हैं. ओके बाय.